So I'm Peter Brocklehurst. I'm the Director of the Institute for Women's Health here at UCL. My background is in obstetrics and gynecology and public health, but I'm also an epidemiologist, a perinatal epidemiologist. So my research interests are in the epidemiology of pregnancy, childbirth and the care of the sick newborn. So mostly what I've done throughout my career has been randomised controlled trials of perinatal interventions, usually large randomised trials, and other observational epidemiological studies. So what I'm probably best known for is the Birthplace in England study. This was a large observational study which looked at the safety of planned place of birth, so women planning to give birth at home or in midwifery units or in consultant-led obstetric units, and looked at the relative safety for the mother and the baby of those choices. One of the big projects I'm currently involved with is the LIFE study. This is a new national birth cohort study which is being led from the Institute of Child Health. The director is Professor Carol Deserter and I'm the Associate Director. This is a study which is aiming to recruit up to 60,000 pregnant women plus 20,000 newborn babies and follow up all 80,000 of those surviving children for the rest of their lives. We have to start the study, we have to recruit the 60,000 women from a variety of antenatal settings, and the 20,000 women will be selected from all births in the UK over a particular time period. One of the projects that we're running alongside that, which I'm the chief investigator for, is something called the Infection and Immunity Enhancement. This is specifically looking at the role of infection and how that determines long-term children's health. So there is a theory that when a baby is born, it's completely sterile. It needs to colonise its gut and its skin and all of its surface area with organisms. And those organisms are absolutely essential for life and healthy development. Where the baby gets those organisms, what those organisms are and how they get established in the baby's gut in particular will determine the long-term health and development for that child. So for example, if that flora is abnormal, this could be related to the development of childhood asthma, eczema, even type 1 diabetes, and people are suggesting that there's an association with long-term health when you're in your 50s and 60s, and there's a relationship with an increased risk of heart disease if that abnormal flora becomes established. So the work that we're doing will take a variety of biological samples around the time of birth and for the first year after the baby's born to look at the establishment of the normal gut flora and associate that with long-term health outcomes for this cohort of children who are being followed up for the rest of their lives.